One Radio, the talk show podcast station, bringing you daily health and information, where daily health is viewed as an ever changing reality. Thank you for taking the time to tune in. This is Daily Health. Now, all information and resources are based on the opinions of the host, unless otherwise noted. All information is intended to motivate, encourage, and inspire positive change and a healthier lifestyle. This podcast contains some quotations, images, and/or excerpts from copyrighted material. These uses fall well within the copyright doctrine of fair use. Welcome, and you are listening to On One Radio, the talk show podcast station, bringing you the daily health and information. Hi, I am your host, Tony Williams. Thank you for being here and listening and supporting. I appreciate it. Now, what we're talking about today is pregnant in a pandemic. Now, every woman who's already been pregnant had kids, and you know exactly how stressful being pregnant can be on its own with just regular everyday life. But you know, the feet swelling, the back hurting, the knees hurt, everything hurt. You want stuff you didn't normally eat. You're a little emotional, tender breast. I mean, all the things that come with, and not being able to sleep on your stomach. I mean, it's a lot of things. And baby moving organs around, kicking organs and carrying on. So it's tough. It is a job to be pregnant. It really is. But to be pregnant in a pandemic, now that's kind of questionable, because you're thinking, okay, this is crazy. I'm pregnant. I got to deal with all the symptoms of being pregnant. But the new added stress is kind of a problem. Not to mention, how does COVID-19 stress, how might that affect your growing baby? Or would COVID itself affect your baby and it's growing? So that's what we're going to talk about. Now, I was going across some articles. Y'all know I love to read, and I read a lot. And I ran across one because I wondered that myself. I can't have any more children. I'm done. I'm in that club. Woo woo. Kudos to everyone who is. But for all those ladies, should I say mommies to be, currently, please take care of yourself. And this one is for you. Alright? Now, a small survey found that stress among pregnant women has tripled since the start of the coronavirus pandemic. Now, a pregnant woman waits in line for groceries with hundreds of others at a food pantry at St. Mary's Church in Waltham, Mass. A pregnant woman waits in line for groceries with hundreds of other people, and she's wondering, is she safe? I mean, that's something to wonder. Now, Alyssa Bradshaw, young lady, doesn't know what it's like to be pregnant without the added worry of a global health crisis. She had her first child, a healthy baby girl, during the summer of 2016, when a single mosquito bite could mean transmission of Zika, a virus known to cause devastating birth defects. Now, 4 years later, Bradshaw, age 44, of Brandywine, Maryland, was pregnant with her second child. This time, it was during the COVID-19 pandemic. While a can of insect repellent gave her a measure of control to protect against the Zika virus, the coronavirus left her feeling particularly vulnerable. And we can all understand that. Now, there were so many unknowns, Bradshaw stated. You just don't know who has it and who doesn't. You can take all the right precautions to keep your family safe, but you just don't know. Which is true. Pregnant mom talks about giving birth while in coma from coronavirus. Unlike Zika, there is no evidence that COVID-19 infection during pregnancy directly impacts the growing fetus. But the stress of being pregnant during the pandemic might. And that's the worry. And I really don't want you ladies out there worried. I want you to be able to breathe and relax, because when you're stressed, the baby is going to feel it. There's a lot of literature that supports the idea that stressors during pregnancy can have a detrimental effect on fetal brain development, on the fetal brain development. And Charles Nelson, a professor of pediatrics and neuroscience at Harvard Medical School and Boston Children's Hospital, stated, now, Nelson explained that during that time of extreme distress, the body releases a cascade of hormones into the bloodstream. Those stress hormones, which include cortisol, have the ability to cross the placental barrier between mother and baby. Some area of the fetal brain are quite receptive to stress hormones. One of those areas is in the hippocampus, which plays a major role in learning and memory. A study published earlier this year in JAMA Pediatrics found marked differences in the growing fetal brains among pregnant women who were psychologically distressed. Among those pregnant women with high levels of stress, said study author Catherine Limpopoulos. I'm sorry, darling, Catherine, if I messed up your last name. I'm just going to call you Catherine because I'm not trying to disrespect your name or whatnot. But she stated we could see negative impacts on the fetal brain, including a disruption to the brain's biochemistry. The study findings were limited to pregnant women whose babies had developed congenital heart disease in utero, which can be a major source of stress for women during pregnancy. Now, I know that's got to be really hard to deal with, and ladies, I'm telling you, you got to breathe. You have to center yourself. You have to find you a cool, calm, and collected area to relax, or even to meditate, read a book, anything that is soothing to you to help relieve some of that stress. Now, this is what it's really like giving birth in the age of coronavirus, Catherine stated, who is also the head of the Center for the Developing Brain at Children's National Health System in Washington, D.C. Now, she has surveyed pregnant women about their stress levels regularly since 2014, based on 163 responses from before the pandemic. 18% reported moderate to high levels of anxiety, 12% reported symptoms of depression, and 26% said they felt stressed. When the pandemic hit, her team repeated the survey with 35 pregnant women. The results were striking, doubling and nearly tripling those percentages. Among the 35 responses, 50% had moderate to high levels of anxiety, 35% felt depressed, and 71% were moderately to highly stressed. Even in the setting of a low-risk pregnancy, where the mom has no risk factors and the baby is developing well, Catherine stated, there really is an alarming prevalence of mental health problems reported by these women. Now, Carrie Toner, age 33 of Washington, D.C., stated the pandemic added an unprecedented level of stress. Her daughter, Lennon, was born a month ago. Carrie Toner during pregnancy and after with her daughter. It was her first pregnancy, which was already a stress-provoking time, Toner recalled. The pandemic hit, you really felt like you've lost control. And we can understand that, because just being pregnant, there are going to be some times you're going to feel like you don't have any control over anything. But you have to breathe, you have to relax. No matter what, keep your baby's health in mind. Now, for Bradshaw of Maryland, the sources of COVID-19 related stress during her pregnancy were staggering. 6 people in her family, including her husband, became ill with the coronavirus after attending a funeral in March. At least 3 family members had to be hospitalized. 2 of those loved ones died, including Bradshaw's father-in-law. Hospital rules prohibited family from being with him when he died. He did not live to meet his grandson, Emmanuel, who was born in June. Alicia Bradshaw and son Emmanuel. Alicia, the experience was devastating. It's unknown whether she too was infected. Her doctor declined to test her because she had no symptoms of COVID-19. Now, that's why I have a problem with that. I really believe all pregnant women right now should be tested. If you can go and get tested, please do. That will give you a peace of mind, and that will be some stress off you as well. The stress won't be completely gone because you take the test, but it will give you some semblance of a peace of mind, even if it's just a small one. Because the less stress, the better your baby will grow. The less likely there will be, too many problems with the baby from stress. Now, the coronavirus has disproportionately impacted racial minorities, particularly Black Americans. The Center for Disease Control and Prevention has reported that the proportion of blacks with severe COVID-19 is greater than whites. Pre-existing conditions such as type 2 diabetes, high blood pressure, and obesity are all more prevalent in black communities and all increase the risk for COVID-19 complications. Now, a woman who is pregnant, and if she has some of these other disorders and diseases, you have to be very careful. Now, Bradshaw and Toner must pay close attention to their mental health now that they're both in the postpartum phase. Please excuse me, guys. I'm tripping up on my words. Even under normal circumstances, the extreme exhaustion and physical toll of having a newborn can be particularly daunting. Armed with the previous research that shows a link between maternal stress and impaired fetal brain development, Catherine and her team at Children's National are now focusing on ways to alleviate stress during pregnancy. Kudos to you, Catherine Limperpolis. Limperpolis. I tried to say it. I'm trying to give her credit. Stress is a modifiable risk factor, she stated. The group has begun a study called Project Rescue, which aims to enroll up to 500 women. Study participants will be randomized to different programs, such as mindfulness, yoga, breathing techniques, and sleep health. The research project will follow the women and their babies through age 3. Now, Catherine goes on to say, our hope is to show that reducing levels of stress and anxiety can also have a positive effect on the development of the baby. Now, Bradshaw has relied in part on friends who let her vent her frustrations virtually, of course, keeping in mind with the social distancing. But Bradshaw said her faith and the practice of meditation has helped the most. So ladies, meditate. If you're pregnant right now, or even if you're not, meditate. It will help take stress off. Check out my meditation podcast. Now, it continues. Even if it's only 10 minutes, Bradshaw stated, stepping away to meditate can help you gain some sort of stability when your day feels chaotic. Just being able to breathe through it. I may be stressed, she said, but I don't need to let stress overtake me. And especially when you're pregnant, we can't harm the baby. We go through everything to protect the baby. From what we eat, what we drink, where we go, how much rest we get, even how much exercise we get while we're pregnant. Now, I know being pregnant during this pandemic is very stressful. So I just wanted to let let you ladies know that there is hope and there's something that you can do to relieve the stress. I pray that you will have happy, healthy babies to join this world and make it a better place. But we gotta stay stress free. So try meditation, try yoga, try my sound meditation podcast, um, baths. You can have spa night at home in your, bathroom. You can run a tub of warm water, put some Epsom salt in there. You can light candles. Heck, you can even have your favorite fruit while you're sitting in there. That's just a little tip from something I did back in the day. But there's hope. And I don't want you ladies to feel like you're hopeless. And you're just stressed completely out and don't know what to do or how to feel or what to think about being pregnant during this pandemic. Don't let it stress you out. You can take control of that and work on reducing stress. It's good for you and it's good for the baby to just relax and just breathe. So take care of yourselves. Try not to stress. And love yourself and your unborn baby. Don't stress. Until next time, be good. You have been listening to On One Radio, the talk show podcast. This has been Let's Talk Daily Health, where daily health is viewed as an ever-changing reality. If you would like to get in contact with On One Radio, the email is onOneRadioTalk@gmail.com. Place it to the attention of Daily Health. I have been your host, Tony Williams, and thank you for listening. For more, you can find me on YouTube. The name is Tony On One. You can find On One Radio on Facebook, On One Today One's private Facebook group, WordPress, Twitter, Instagram, Tumblr. On One Radio's out there. And I care about your health. And so should you.